All right, good morning. Very glad everyone could be here today. So Overwatch, in case you didn't know, is our real-time alerting and data solution platform that runs within Jackson's enterprise integration environment. I'm going to walk you through a little bit about who we are as an organization and how we kind of got to the point of being able to launch Overwatch. So Jackson as an organization is one of the largest public health systems in the country. We are the teaching hospital for 2 universities, and our health system spans 6 different hospitals, a network of urgent cares, primary and specialty care clinics, long-term care facilities, correction health services, 2 trauma centers, and the Miami Transplant Institute. Our Transplant Institute was recently named as the 2nd largest in the country, making us a very unique site with lots of different disciplines. Now, the culture of Jackson is very unique, and over the last few years, we've been experiencing a renaissance of technology within the organization. This means that we've been upgrading, revitalizing, and replacing existing solutions, and we've also been modernizing our infrastructure to keep up with the modern pace. Now, Jackson Health System is a 100-year-old institution, so as you can imagine, over that course of time, we've developed a bit of maintenance and some things that can use some revitalization and modernization. So as we go down that, we've developed a culture in IT of being exploratory and partnering with the business. When IT was first kind of introduced many years ago into healthcare, it was a very service-oriented industry where our focus was supplying and fulfilling requests from the business. But as we've moved forward and we've modernized, we've now become strategic partners, where we partner with the business to determine the best business value and the use of technology within the organization. Continuing along that path, we have the rising importance of data as an asset. So this is an important distinction from using data as a resource, where we put it into reports and we make it something that someone reads about. We really want to put the data to use and treat it as an asset within the organization and actually get real business value from it. And that leads us to enterprise data management, which is the maturity model we're shooting for, which is taking that data and using it for more than just siloed pieces, but actually applying it in an enterprise fashion. Now, the data integration strategy at Jackson, which is only about 4 years old, took us very quickly through the different paces of how we use our data and how we transmit it through the organization and how we turn it into that actionable platform. For one, we took integration from behind the curtain, where it was traditionally associated with infrastructure and treated similar to networking and routers, and we moved it onto the stage and aligned it with data, where it truly belongs. And in a modern organization, integration is tightly coupled to all of the data initiatives throughout all of the different initiatives and departments that you have active. And it's just as much an art as it is science. So it's more than just plugging away at things. It's also designing an architecture that needs to go in to make sure that it's useful. And the centerpiece of this is the enterprise integration engine, which we now have in place at Jackson, and we use to funnel all of our data flows through. This provides us a single centralized point that we can use to transmit data to any application, to a file, to the data warehouse, and it provides that one normalized stream that we can tap into for many different things and make it truly reusable. And last but not least is the creation of the data enterprise. Data enterprise is a very generic term, but it really encompasses how the data ecosystem lives within your organization. At Jackson, our ecosystem extends beyond just a data warehouse or siloed databases, but to a true ecosystem that's generated through the integration engine and allows us to funnel data into different places. Now, has anyone been in this situation before, where you're asked, we need to use our own data to solve a problem? And for some reason, the 2 options that come up the most are buying an application and turning to consultants. And I realize the irony of making that statement surrounded in an auditorium of vendors and consultants. But I still think it's an important point, because the third question that we don't ask ourselves is, why don't we just do it ourselves? Right? This is data that we generated while taking care of patients, but somehow we don't trust ourselves to use the data we created. And oftentimes, this scenario ends like this. Thankfully, I wasn't thrown out of a window, so I can be here with you today. But sometimes it can feel like you were. So let's look at those traditional solutions a little bit. So we have applications, and we have what's referred to as outsourced services, which would include consultants, subscription services, things of that nature. And with applications, the disadvantages are obviously the time it takes to spin up RFP and procurement processes, implementation time, training, users, ongoing maintenance, And for outsourced services, there's that disconnection where the vendor becomes an extension of your company, of your organization, and they're learning about your business, but maybe you aren't. And then there's also the knowledge not being retained in-house and a disengaged patient experience. Now, for a long time, these disadvantages have just been seen as a cost of doing business within an organization, right? We're going to buy an application. This is the cost of business, these disadvantages. Same thing with outsourced service. But what if there was an alternative? So here at HIMSS, Jackson Health System is very proud to formally introduce Overwatch as a true solution platform. This is a little bit of a unique presentation because at the end of this, I'm not going to try to sell you anything because I'm not a vendor. I work at a hospital. I come from the same organizations that you come from. And Overwatch was not born in a corporate park somewhere attached to a business plan. It was born in the trenches of healthcare where all of us work every single day with the only mission to provide better patient care and for our community, for our hospitals, and for our clinicians. So we really wanted to create a unique solution that had unique advantages and distinctions to it. So what is Overwatch? It is a data-as-a-service platform that was developed 100% in-house at Jackson, leveraging our existing technology. It leverages all of the data feeds that go through our integration engine. So it has at its fingertips every single data feed and application flow that goes through the engine is available to Overwatch. It models that data in real time and is able to create different business process flows and decision-making points where then it can take actionable alerts and also integrate data into applications in real time based on what it observes. This type of platform gives us some very unique advantages, in which case we don't, since we're not an application, we don't have users. There's no user interface, there's no installs, there's really no overhead maintenance at all. It's all leveraging the existing data that's already flowing through that engine and being modeled. So there's no additional cost. Development time is rapid. And you'll see in some of the use cases we're going to go into, if you're like us, when you deal with the business, one of the biggest concerns is always how long will it take? Right? Everything sounds great, but how much time will it take to actually make it actionable? You'll see that a lot of these projects take mere weeks to launch off the ground because most of the groundwork has already been done. And there's a unique experience that comes along with Overwatch. So one thing that we found that was kind of an unintended side effect and became sort of a signature of the platform was that nobody had to do anything differently than what they were doing today. It was already reusing the existing data that's being created within that ecosystem and just turning out more value for it and making it more actionable. So no FTE increases, no additional responsibilities or workflows added to anybody. Everyone continues to work the same way that they work today. So our first use case came to us right as we were launching the platform. And I want to make an important distinction here. When we created the platform, we kind of did it in secret. We really didn't want to tell anybody what we were developing or what it was going to be used for. And in all honesty, we kind of built it without any use cases in mind because we wanted that data model to be truly agnostic to any particular use case scenario so that it could be reused as much as possible and flexibility and versatility were at the core of its design. So our population health team approached us with a problem that they were trying to solve, which involved them tracking down ED high utilizers. So we identified these patients as people who were using our ED for primary care and either underfunded or did not have other options available to them. Our population health team struggled to identify these patients and be able to start a conversation with them because they were very hard to track. We could find them historically after the fact, but when they arrived at the ED, relying on either people or relying on the EMR to try and alert, it was not functional, it was not working. So we saw an opportunity to launch our very first solution on Overwatch, and we used Overwatch to track the patients as they hit our ED in real time and send that information to the case managers via text and email. And that allowed them to know exactly what service line they were in, where they were located within the organization, and be able to intercept that patient, start a dialogue, and get them into a funded care option or get them into a primary care option. So in terms of outcome, it was astounding. To be honest, it far exceeded the expectations, I think, of what we set out to accomplish. We started in January 2018. From the first meeting to the time that it went live was 4 weeks. People didn't believe that it could be possible. Our population health team certainly was expecting months of an application to be installed. In 4 weeks, we had it operational, and it went to work. We started with only 3 case managers managing 100 patients at a time. And through that effort, we were able to not only track these patients at the time that they hit the ED, but after they were enrolled in the program, we continued to track and follow along with them, ensuring that they were making their appointments, checking if they relapsed to an ED, notifying of key milestones within the program to the case manager so that they could attend and continue that dialogue, continue building that relationship to get them the appropriate care. On the financial side, we also managed to reduce the net subsidy by over $2 million in 2018, and now with a full complement of case managers, we're expecting that number to break $6 million in 2019. Our next use case took us into patient experience. So hot off the success of what we did in population health, we had an opportunity to help the organization on the patient experience side. Here, and again, thinking of Jackson as that 100-year-old institution, we did have an antiquated paper mailer system in place for appointment reminders, and our no-show rate was very stagnant throughout the organization. So we said, how can we modernize this? And again, that instinct to want to purchase an application and bring that into the organization, go through the procurement process, develop it, launch it, all those different pieces. We bypassed all of that, and we said, it's our data, we can use it ourselves, and we can make this effective and treat that data as an asset again, put it to work. So that's what we did. Not only did we create a modern reminder that uses email and text messages, we took it one step further and tried to address one of the biggest root causes we have. Now, I'm not expecting many people here have been to Jackson, but if you have, it's a sprawling campus with dozens of buildings, and it's very easy to get lost. So oftentimes we'd have a patient come in, find the closest parking garage they could as soon as they arrived on campus, park, only to find out that their appointment was 16 buildings that way. So this was a huge displeaser and caused a lot of disconnect between getting our patients in a pleasant experience once they arrive on campus and getting to their appointment. So we were able to dynamically produce pictures based on which parking garage was actually closest to the appointment location they were intending to. So that when they arrive on campus, they park in the right garage, they have a picture of what it looks like, they know where they're going next, and they have a picture of that building as well. And we dynamically format these messages based on their preferred language, so this way it's a more personalized experience. So how did we do once we launched it? So we launched this in April of 2018. This pilot took us only 6 weeks to develop. Again, a few more complicated pieces involving pictures and mapping some data that we didn't have accessible, but still only took us 6 weeks. We leveraged all the existing scheduling data in the EMR. So again, that unique signature takes place where we don't have anybody doing anything differently. Our schedulers today schedule exactly the same way that they scheduled before Overwatch was deployed. Nobody had any additional responsibilities. We're just using our data more effectively and using it more efficiently. So we went ahead and launched it. We now run reminders for only $3.10 a day, compared to several times more than that for the paper mailers, and we have a much more effective system for it. And across the organization, we saw no-show rates improve by up to 16% in some areas. This is a stat that really blew us away because this was something that was very stagnant in the organization, many attempts to try and make a change to it, and all it took was using our data more effectively, treating that data as an asset and operationalizing it into actionable information to be able to make something that was much more effective. Now, before I get into our current pilot, I want to say that for the efforts behind those two pilots, as well as the platform itself, we were very surprised and very humbled to learn that we were named a Digital Edge 50 Award for Digital Innovation for 2018. That's a first for us as an organization, and we're very happy to be receiving that award. Now, our current pilot is also aligned to patient experience. Many of you checked into a hotel today as part of your stay here at HIMSS, and chances are you got a text message welcoming you to that hotel and asking if you need anything. We wanted to create a similar dialogue and experience for our patients when they arrived over at Jackson. So what we did is we brought Overwatch on board and said, okay, for all the patients that come in new in certain piloted areas, we want to send them a greeting text and let them know that we're here and we're listening to them. And oftentimes, a patient's information, their story for their encounter, for their stay at the hospital, it's told by everybody else except for them. We have applications which our clinicians use, the registration staff. We have all these different members of our teams that speak on behalf of that patient by documenting and creating results, but the patient themselves doesn't have a voice. This allowed that patient to have a voice, and more than that, to actually have a conversation with us. And it allowed them to send text messages, whether they're in the ED and they're cold and they just want a blanket, or they want to know when their next test is scheduled. It allows them using their phone in a simple, just like they would text a family member or a friend, to interact and have that conversation with us as caregivers. And then when they leave, we send them a post-discharge survey, which gets immediate feedback of how they enjoyed their stay. How was things at Jackson? How did you enjoy the clinician that you had? How was the nurse? How were you feeling after your stay there? And just last week, we actually got a very interesting story that was very touching to a lot of us. We had a patient that came into one of our EDs. They were given one of our post-discharge surveys after they were sent home with some antibiotics. And a few days later, they reported back that they weren't feeling any better and their symptoms had actually gotten worse. That opened up and continued the conversation with our clinician. We brought them back in. We actually found that this patient had turned septic and was now in a life-threatening situation. And because of this conversation, we were able to get that patient into care in a very critical time period, treat them, and prevent that life-threatening situation from escalating. And having a contribution of technology towards a life-saving event like that is truly remarkable and something that really made us step back. We don't have an ROI yet for this because the pilot's so new, but with something like that, it goes beyond just an ROI because we're impacting lives in a way that was so different and so changed from how we tried before.